This is Mon Health Talk, a weekly program focusing on the dedicated physicians, nurses, and staff at Mon Health, the region's premier community hospital system. People with skillful hands and bright minds using state-of-the-art technology. We don't just practice medicine, we care for people like family. That's why at Mon Health you can feel the difference. Once again, welcome to this edition of Mon Health Talk.
Good morning. Welcome into the program, Mon Health Talk. I'm Dave Wilson. Joining me today, got a couple of guests on the line. We have Krystal Atkinson, who is the Chief Nursing Executive for Mon Health System. Good morning, Krystal.
Good morning.
And we have Chad Callen, Chief Executive Officer for West Virginia Junior College. Good morning, Chad.
Good morning, Dave.
Well, guys, we're going to get into the announcement last month that Mon Health and West Virginia Junior College will be working together on a collaborative nursing program. We'll get into that, but first, like with any guest, we like to talk to you guys a little bit to begin with. So, Chad, since you're at least new to Mon Health Talk, we've talked to you on WVJR before, but first time here on Mon Health Talk, I do believe. Give us a little bit of background on you and how you ended up in your position.
Yeah, thanks, Dave. Well, I'm actually a West Virginia native, born and raised, and currently live in Morgantown, West Virginia. But how I got into the college system, it's actually a family affair, and I love telling the story. This year, we're actually celebrating our 100th year anniversary at our Morgantown campus and 130th year anniversary for our Charleston campus. But 60 of those years has been operated by the same West Virginia family, 3 generations, in fact, and it was started by my grandfather over 60 years ago, and he had 4 children that have operated in the second generation, including my mother, who ran our Morgantown campus for over 40 years and still works there today. And now currently, my 2 cousins and my wife, who I started our online division with, she works with us. So 3 generations of the same family. I was practically raised from the day I was born. When I was born, my mother had me in the bassinet next to her desk, and I ran through those halls as a child, and I took classes when I was in high school and middle school, and so I've been there my entire life. It's a part of me.
Sounds like it was your destiny, Chad. That's where you were supposed to end up.
I would say so, Dave. Pretty much.
And Krystal Atkinson with us, Chief Nursing Executive for Mon Health System. And Krystal, I know you've been on with us before, but just give people a reminder of your background.
Yeah, thank you so much, Dave. I am a native of Richmond, Virginia. Worked in Virginia and New Hampshire prior to coming to West Virginia for about 28 years, and had a wonderful opportunity to come here to West Virginia and join the Mon Health System, and I have enjoyed every minute of it. I've been here for the past 2 years. My husband and I love it.
All right, Krystal, I want to start with your perspective. Last month, it was announced that Mon Health and West Virginia Junior College will be working on a collaborative nursing program. How did this idea come about from your point of view?
Yeah, so I'm going to let Chad give some more detail, but, Chad and David had an opportunity to put their heads together following a conference where they were both attending. And then once David shared it with me, it was a no-brainer. Certainly, I love having the opportunity with this being Nurses Week and Hospital Week, certainly to be able to talk about the great things that are happening between our 2 organizations. I'm extremely excited about it.
All right, Chad, pick up the story. Krystal kind of set you up there. You and President of the Mon Health System, David Goldberg, you're having a conversation at a conference. Pick up the story from there, how we end up with this collaborative program.
Yeah, things like this often happen this way. We were at the West Virginia Chamber's annual business summit at the Greenbrier, and it was the last night of the event, and I have a 3-year-old at home, so I was like, you know what, I'm just going to go have dinner by myself. Usually you go with big groups of people, and so I sit down at the Jerry West 44 restaurant, the bar there, and put an order in, and I hear this, there's only 2 seats there, and I sit in one, and I hear this voice that I recognize behind me, and he asks, is this seat available? And it was David, and so, at the time I hadn't, David and I weren't too close, so I knew who he was, but we just got to talking, and I was sharing with him the innovative things that West Virginia Junior College was doing for nursing, and specifically with our rural nursing program, which aggregates students across multiple rural regions to train them for registered nursing positions. And I told him that, I thought that we could do add similar value to non-rural communities and non-rural hospitals. And I said, but I really needed a hospital partner because, this was kind of a bold idea, and not just any hospital administrator would buy into this. And, this just goes to show you what a visionary that David is. Without hesitation, I don't even think he took a breath. He said, I'll be your partner. Call me on Monday. And so I did, and the rest is history, and now here we are.
So, Chad, from the academic side of the aisle, how is this program going to work?
Sure. So the students will attend their didactic or theory classes completely online, and that's somewhat uncommon. A lot of times when you hear hybrid programs in the nursing sense, they're talking about their general education classes, but we've taken the nursing didactic content and put it online. And then only the hands-on portion will they report to a location physically, and in this case, that will be their lab and their clinicals, and they will be doing those at the Mon Health facility. And the reason why this approach is important, and the reason why it increases capacity so that we can get more nurses into the system, is that a lot of times it's the non-traditional students that stay at the bedside, and that's where the crisis is occurring, at the bedside. And non-traditional students, they have lives with families. They have to work. They can't just put their lives on hold to go to nursing school. And so this delivery modality allows those students to attend nursing school while still maintaining employment and their other responsibilities.
And Krystal, when you saw this program coming together, what immediately jumped out to you as the benefits for these students who will be enrolled in this program?
Well, one of the hardest things for a student to do post-graduation is the assimilation process. So looking at the ability to be able to have the students in the facility as early as possible really helps cut that away, right? So they get assimilated to the culture of the organization. They become very familiar with the facility. Therefore, once they get to that place where, they are the nurse and they're moving to that place of being on their own, all of that awkwardness in the beginning really has been, that's done, right? They know the people that they're going to work with. They feel very comfortable asking questions, and that's exactly what we need. The new nurses, they feel nervous, and we really don't want them in a place of doing things where they're uncomfortable. This cuts that out completely, where they have assimilated into the culture and the organization, and they feel very comfortable reaching out to a peer for assistance.
We're talking to Krystal Atkinson, Chief Nursing Executive for Mon Health System, Chad Callen, CEO of West Virginia Junior College, and we're discussing the new collaborative nursing program with the Junior College and with Mon Health System, and we will continue that conversation right after we squeeze in a quick break. You're listening to Mon Health Talk on WVJR.
Now back to Mon Health Talk, a discussion of the issues, people, and procedures in healthcare today. If you have a question for one of our healthcare guests, call now at 304-296-0041.
Our guest this morning, Krystal Atkinson, Chief Nursing Executive of Mon Health System, Chad Callen, Chief Executive Officer of West Virginia Junior College. So, Chad, when does this program begin? Are you currently recruiting students?
No, our enrollment's not open yet. It will open in the fall, and we'll start our first cohort in April of 2023.
So prospective students should be paying attention right about now. If folks are interested, or students are going, okay, this sounds like something I would be interested, or I'm interested in, wait for that application process? Or should they start reaching out now? What should they do?
No, they can reach out now. We're keeping a list for those that want to enter the Mon Health program. We do have a more traditional program that starts in the fall, and so they'll have the option to do either.
And Krystal, before the break, you were talking about some of the things you can't learn in the classroom, the awkwardness you have to get over, actually getting into the clinical environment there. how valuable is that, and how important is that? Because you can read all the books, you can take all the tests, you can learn all the biology, et cetera, but there's just no substitution for the moment when you're actually in the room working through all that. So how valuable will that be to work in conjunction with the traditional, I guess in this case it's not necessarily traditional, but the traditional academic work that goes with the program?
Yeah, it's priceless. We have the ability to do simulation with our students as well as our current nursing staff. So think about having the opportunity to go into any type of critical situation and have the simulation done, and then realize mistakes that were made and be able to talk about that with an instructor. Versus you are with your patient, there's a situation, and you don't have any idea what to do. Now, granted, every situation, we won't be able to cover everything from a simulation perspective, but again, when you're starting out, as early as these students will be starting out, and developing that relationship with a preceptor, a mentor, etc., it certainly will be very much more comforting when you do face that first opportunity of something that you haven't seen before versus just coming in cold.
Hey, Krystal, what role will your current nursing staff play in this program?
So just as any other program, we have nurses that will be known as preceptors, and basically that is the nurse that is the experienced nurse that is taking the student nurse under their wing, if you will, and going through processes such as providing medications to the patients, going over orders in the medical record, having an understanding of what the day-to-day processes, what the nurses go through throughout the day. In addition to that, they will have the ability to be adjunct instructors with the West Virginia Junior College. And that, for some of our teams, that's extremely exciting because they, it's kind of like, let me try to figure out, a school that I can associate with. This takes away all of those barriers and makes it a lot easier.
Chad, other than sitting down and having a nice conversation with David Goldberg over dinner, why is Mon Health System the right system to partner with for this this collaborative nursing program?
I'm glad you asked that question, Dave. It's really important when you're going to do something like this, and it's two words: cultural alignment. And I already talked about how both of our organizations are rooted in family and community, but there's another thing. David and I are very aligned at the top. We have, in many ways, we're a lot alike in the way our philosophies on how to run an organization, our leadership styles, and we resist bureaucracies. We move quickly and want to get things done. Additionally, we know our people and our customers very, very well. We stay very close to the front lines. But one of the other things that I found it was just poetic in a way whenever I walked into the Mon Health halls for the first time. If you were to walk into the halls of West Virginia Junior College, you would see our core values on the walls, and they spell the acronym We Care. Well, coincidentally, the first time I walked through the halls of Mon Health and their administration, I saw their core values on the walls, and they said, I care. And so that just goes to tell you that from the top all the way to the front lines, you have this sense of caring for each other, caring for your clients or your patients. Caring is rooted in everything we do, and that's really, really important because we're going to be intertwined quite tightly.
Krystal, let me flip that question around and ask you why it made sense for Mon Health and the Mon Health nursing program to partner with West Virginia Junior College.
I think Chad said it best, just from a cultural perspective, right? So our mission, we want to enhance our communities and focus on one patient at a time every time. They do the same thing for their students, just the care and the focus that they have on ensuring that their students have everything that they need. That's exactly what we want for a nurse coming to the bedside. We want to make sure that we have that focus and that every patient has that unique experience, just like every student should have that unique experience. And it's not something that is just cookie cutter, but just very generalized and focused on the needs of the student as well as in the hospital, the needs of our patients.
Krystal, ultimately, what's the benefit to patients of this program?
So there's no surprise here, Dave. We've had a nursing shortage for before we even heard of a thing called COVID, right? When we got into the pandemic, I think really what that did was really put a spotlight on that. We focus on quality and the outcomes that our patients receive. So having the ability to be able to have this partnership, to have the ability to have a streamlined effect for staff to become onboarded and part of the system, it's a win-win for our patients to ensure that we do not have deficits from staffing at the bedside.
Krystal Atkinson, Chief Nursing Executive for Mon Health System. Chad Callen, Chief Executive Officer, easy for me to say, at West Virginia Junior College. We got to squeeze in our final break. We'll continue our conversation in a moment. You're listening to Mon Health Talk on WVJR.
This is Mon Health Talk, providing a window into the Mon Health system and the dedicated healthcare providers who work there. If you'd like to comment or ask a question, please call 304-296-0041.
Couple of minutes left with our guest, Krystal Atkinson, Chief Nursing Executive for Mon Health System, Chad Callen, Chief Executive Officer, West Virginia Junior College. Chad, are there any other collaborations between West Virginia Junior College and Mon Health?
Yes. As unique as the nursing program is, one of the most unique elements of it we haven't even announced yet. We're going to be announcing it hopefully by the end of this month, so stay tuned for that. But in addition to that, we have a collaboration beginning with the revenue cycle management or medical coding field of operating a hospital. We're working with their team to create a more direct line for placements of medical coders into their system, but they also have a lot of current workforce in this field that's not yet certified. And so we're going to be working with them to develop short courses to get their team, those that aren't certified, give them the opportunity to prep and get certified, and also be available to the public as well.
Chad, where can folks go for more information about the nursing program we talked about today?
They can go to wvjc.edu and request more information.
And the phone number, 877-25-online. Again, visit wvjc.edu for more information there. And, of course, more information about the Mon Health system is always available over at Mon Health's website as well as the Facebook page. Krystal Atkinson, Chief Nursing Executive for Mon Health System, thank you very much. And Chad Callen, Chief Executive Officer, West Virginia Junior College, thank you very much. Appreciate it, guys. Good luck with the collaboration.
Thank you so much.
Thanks,
We
Dave.
appreciate it.